So we're viewing this obviously distal gunshot wound. You can see that the edges are clean, and there was a clean entrance wound. And as we open, you can see some blood in the wound itself, the gunshot wound itself. We're going to pull the skin back, and you can see that there is blood there. So that's a real entrance wound, and we just have to find the exit wound. So we're looking at the spine here, and I'm imagining, or at least surmising, that there is some bleeding right along the aorta there. So I think that bullet which came out on the right side of the abdomen transcended it. So he must have been shot from right to left, and then it came and hit that aorta, because I believe that's some bleeding, some significant bleeding there. That's just powder where they do the drying with the autopsy. There's definitely some bleeding underneath that powder. You can see some of the darker, that's blood probably, but obviously he's been. And we're going to see this part right here. I want to make sure that that's not an exit wound right there, but there's some bleeding along the left abdominal, left lateral abdominal wall. So we're going to see what that is about as well. So this was an embalming repair here, but I think this may have been we're on the left side of the abdomen, and we're looking at the soft tissue on the distal part. So go down, open that for me really wide if you don't mind. And you can see that there is blood in that soft tissue. Although you see some, if I can zoom in, kind of squeeze, open a little more for me. Yeah, like that, kind of spread that open for me. All right, so I know it's hard to say, but I'm surmising, but we have to still correlate with the original prosector's report. But I think there may have been an exit wound there on the left side of the abdomen.